So good morning, everyone. Today marks 427 days since our first case. We're literally in week 62, and we're almost there. So we're getting there together, and we need everyone to continue to do their job to get vaccinated. Don't hesitate, get vaccinated so we continue to move in the right direction. Thank goodness no one's passed away. We still stand at 378 people that fell to the COVID-19. So again, my thoughts and prayers to the family. The good news is CDC finally came out. Well, they did come out, and then New York State gave us guidance last night on the age groups 12 to 15. So which is a good step now to hit another category of age group that unfortunately gets COVID, and thank goodness they don't get sick to it and end up in the hospital, but they do spread it. So this is just another tool in the arsenal we can use to step forward. But the important step for us in the right direction, because the clinical trials have shown the vaccine to be extremely effective and safe among that age group. I say to parents too, please read, call your pediatricians, call your doctors, go online, educate yourself. There's a whole trial base they went through, and with the side effects and everything like that, very minimum. So please help us do the right thing and continue to go in the right direction. A parent or guardian will be needed to be there with the kids from age group 12 to 15. Obviously because it's a smaller age group. So, and they'll need to sign a consent form, and and that's about it. They don't need to show any, birth or social security or any of that stuff. A parent just needs to be with them, or a legal guardian, so please. The first dose of Pfizer vaccine clinic today at the Albany Capital Center is from 4 to 7. Again, walk-ins are welcome. People walk in, and that's good. People just wait, and when they're ready, they're going to come in. And I appreciate the people that do stop by and decide at the last second. Sometimes that's better for your anxiety to just walk in at the last minute and get the shot when you're ready. Free parking will be available at the Renaissance Hotel, as always, and our Department of Health at 175 Green Street from 9 a.m. to 3 is complete walk-ins anytime, unannounced. You don't have to pre-register. You can just walk in, get your vaccine, and there's someone there to talk to too, as Dr. Whalen has said before. There's someone there to help you with any questions that you may have, which is also good. So, and as always, through our Department of Aging, anyone over the age of 60, Deborah Tano, thank you in setting this up, and all of us working on this. We will come to your house. We will pick you up, you and your aide. We will get you there and get you vaccinated and back to your house and not have to worry about transportation. That number is 518-447-7198. That's 447-7198. Please, by all means. We also continue to offer walk-in Pfizer vaccines every Friday at the Emmanuel Baptist Church, 275 State Street in Albany. Anyone can come in between the time of 10 a.m. and 1. No appointment is necessary, and this is being done through our partnerships with CDPHP, so thank you for that. And Focus Churches of Albany, thank you for all that. And again, working together in a partnership to get it done, because that's what it's been about for these last 62 weeks and 421 days, is basically working together, coming up with new ideas. And I can't tell you how many times Dr. Whalen and I had to readjust. We thought we had a great plan, or working with Juliet, and you had to change, and you had to adapt. And that's what I just said. It's, we got to continue to evolve with this as this evolved and got us through it all. But some of the good stuff. As of yesterday, we've had 56.9% of Albany County population has received at least the first dose. 48.3% have been fully vaccinated. We're getting closer to that halfway point. The statewide first dose vaccination rate is now at 48.8%, so we're well ahead of that. And the fully vaccination rate is 40%, which we're at 48.3%. So good stuff. We are doing our job, but we need to continue to people to roll up their sleeves and do the right thing, because like I said, you want to get away from this. You want to get back to normalcy. You want kids back in summer school, maybe because I spent a lot of time in summer school. Back into camps this summer, and fully back in camps, and or again with school fully opening up. We need people to buy into this. We need people to move forward, and we'll get through it all, right? The increase in Albany County's first dose vaccination rate has slowed down, though. It's now an increase by 2% each week. In the beginning, we're literally at 4% or more. So again, we're hitting that wall. We need more people to get vaccinated, and it's great. We still have the Washington Army going on, and the site from the state through the governor through the state health department at Cross Gates. Please, by all means, you can walk into there. You don't need to make a pre-register. You don't need to call ahead. And I honestly, you can decide what shot you want. If you want the J&J, Pfizer, whatever one you want, they will offer it to you. Because I know people have preferences on what they think is best for them. So I know it's declining. People just, think we're out of this. We're getting there. They can just hold off because they need the vaccine. Please, I can assure you, and Dr. Wellens will assure you, it's still here. It's still around. It's not done with us. Things are just getting better because of the people that have done the right thing. So thank you to everyone that's doing the right thing. Last week, we recognized National Nurse Week. And yesterday I recognized International Nurse Day. The last 61 weeks have been hard on everyone, especially the people in the healthcare industry. Our nursing homes, our hospitals, they're on the front line. They're the ones dealing with people that have COVID-19. They're holding their hands. And unfortunately, when people are losing loved ones, 378 here in Albany County, and in the 3.3 million lives across the globe, it makes it tough. Right, and you can't say goodbye, and you can't be there with them. These nurses had to deal with it, and it makes it very hard on them. So one of the studies from Yale School of Medicine found that nearly 25% of all healthcare workers showed signs of PTSD, and almost 50% had problems with alcohol or use of disorders during this pandemic. So these are things that we need to continue. Be there for our nurses, be there for our healthcare workers, take a step back. I know everyone, like I've said this before, that's why we sent up the mental health hotline the next day when this all started. Everyone handles stress differently, and it's all how you handle it. And please just think of someone else, and walk in their shoes and what they have to deal with. And, if we get vaccinated, we're helping them do their job. So they don't need to see us, and we don't need it to be in the hospital, and they can continue on. So please do your job and think of these nurses that are on the front lines every day. So to honor the nurses and their sacrifice by getting vaccinated, help us to stop the spread of the virus, help us finish off COVID for good, which we need everyone to get vaccinated, but because ultimately it's up to how this pandemic ends. We can end this how we want to end this. These are those who say if we get 75 or 80% of the vaccine rate, but the decision's made by us, by individuals, and it's made by, whether or not we want to actually be part of the solution or part of the problem. And I've said this before, it's easy to be part of the problem. It's harder sometimes to be part of the solution and put your best foot forward. And I want to say to every resident in this county, in the state, in the Capital District, in New York State, and around the globe, thank you for doing your part in being part of the solution. It's easy to be a naysayer, and it's easy to slam things that we do, but as things change constantly, and we've never dealt with this, it's been challenging. And I've said this before, in the beginning they didn't, Dr. Fauci even said about masks, they didn't even say you had to wear a mask, and it changed, it evolved, we got educated, we learned from it, and that's what you can do, educate yourself. And I continue to tell people that. If you look at places like India, South America countries like Colombia, with extremely low vaccine rates, it's gotten really bad there, and it's been in the news. And just go on and read what's going on in these countries. And now we're trying to help them out. President Biden's trying to send vaccine over there to everyone, every country in the globe, trying to help out. Thank you. But again, we can get through this if we just educate ourselves. So compare the United States, where COVID deaths are the lowest level in 14 months from around the globe. So again, things are getting better, but it doesn't mean we relax. It doesn't mean that we forget about it. And I know things are starting to open up May 17th. I know that we're getting there. Things are starting to get about normal. Swimming pools and stuff are opening up, and you still got to have the 6 feet, but it doesn't mean it's over with. So we need to continue for you to do the right thing. As of today, there's 24,088 cases of COVID-19 in Albany County. We have 23 positive cases since yesterday. Our 5-day average is 17.4 new positive cases each day. Before that was 19.6, which is good. We're going down. Of the new positive cases, 5 had close contact, 17 didn't have a clear source of infection, and one was a healthcare worker. Really good news is that the Albany County 7-day average for percent positive rate is still at 1%, which is actually the second lowest in our region. And the capital region is at 1.4 for the last 7 days. So we're holding our own. We're finally doing good. And, and I can tell you how many times Dr. Whalen and I probably want to cry looking at the dashboard as the rest of the counties in the capital district were going down. We were still steadily up top. So this is all good stuff. And to have 120 active cases is good. But, and there's currently 364 people under mandatory quarantine. Yesterday it was 358. 41 new recoveries since yesterday, 1 new hospitalization, 17 people currently in the hospital, that number's going down, which is good. Yesterday it was 19, 5 patients in the ICU. It was 6 the day before, and that number, as you know, back on Monday, I think we're up to like 11 or 12 or 10 in the ICU, if I stand corrected. But we still need people to wear their mask. We still need people to do their part. We still need people to cough in their arms, clean their hands, stay 6 feet apart, and we need people, to do different things. And I know Dr. Whalen, we got some good announcements we're announcing on Monday, some partnerships we're trying to do. Again, Sherry, it's not like the Ohio governor, DeWine, that is giving $1 million out every Wednesday to a pool of somebody for 5 weeks. We're not going to be making announcements like that. But we're trying to give other incentives to get people to come on out and get the shots and the vaccine and be part of the solution, again, not part of the problem. And I can't thank everyone that has stepped up. And I know Dr. Whalen, we're going to talk about one of them. So again, Dr. Whalen.
Good morning. So we know that vaccine is the way that we're going to get through this. It really is the best way for people to ensure the safety of themselves and their family. So the decision yesterday, the final decision, which we anticipated and discussed in our press conference last week, to allow the 12 to 15-year-olds to receive Pfizer vaccine is a very big one and one that we are welcoming. I have many, many friends who have children this age who have been messaging me for months saying, when will this age group be available? So I'm very happy to be able to offer that opportunity starting today at the health department and at our pod at the Capitol Center, which will be from 4 to 7. And just to ensure everybody knows where that is, it's not at the TU Center. It is behind the TU Center where the Capitol Center is located. We'll be there from 4 to 7. As the county executive indicated, there are walk-ins, so if you would like to come, but there also, as of this morning, has been a link released. So if you want to ensure an appointment and have a particular time that you would like to come down, please feel free to use the link and sign up. We know that this decision was not made lightly and was made after thorough review of data on safety and really monitoring what we've seen in the older population and in the pediatric population. And the safety data is better every day. Again, I know I've shared here before that my own 16-year-old has received Pfizer and she is currently fully vaccinated. What are the benefits of vaccine for this age group? Of course, we know that the effectiveness is on the order of 95%. So this means that there is a strong protection from this vaccine against getting COVID disease, and certainly against getting serious disease. It also ensures that you will be able to reunite family members if you had concerns around the 12 to 15-year-olds in your family, visiting with older relatives. This will enable that to go on again. And it enables so much of what is essential and important in the lives of 12 to 15-year-olds. Being able to be in school consistently, because we know that many kids have had their school year interrupted by quarantines and having to be out repeatedly, which is very hard on kids. And the county executive talked about PTSD and healthcare workers, but I think, in the pediatric population, it's been a really tough year. It's difficult for a lot of them to understand this too. Once you are fully vaccinated against COVID, which is 2 weeks after your second dose of Pfizer, you do not need to quarantine. So this is a big welcome for a lot of kids that age. We also know that currently in the United States, the population under 18 accounts for about 20% of our cases. So this is a significant number. It's a significant driver of infection. Although our numbers are going down, we are still seeing people that are being hospitalized, and unfortunately we are seeing deaths. These can be prevented with broader vaccination of our population. So there is a responsibility as well for all of us to do our part and try to ensure that we can get across this finish line so that we can get back to normal and do this safely. As the county executive indicated, if you look at countries where vaccination rates are better, you see countries with less disease. And this is good news. But what we want to do is get to the point of eradication. We want to be finished with this so that we can assume life as we knew it before. So I really do encourage people to come down to the clinic. I want to let you know that we have nurses administering the vaccine, nurses and pharmacists, and we have pediatricians that will be with us today. I will be down there as well, and hopefully look forward to see you. We also are happy to say, a lot of the questions that we got asked early on is, do I get a sticker when I come to the clinic? And so we got stickers. But for the kids, I'm happy to say that Stewart's has given us 500 vouchers for ice cream cones. So if we have kids come down today, the first 500 that come will get a token for a free ice cream cone at Stewart's. And it's a beautiful day for an ice cream cone. So we look forward to seeing people down. We are there to answer questions if you want to walk in and speak to somebody about any concerns that you have about the vaccine. We also continue to work with our local pediatric groups to encourage them to become COVID vaccine providers. We are happy to share the vaccine that we receive with our local providers if they are part of that program and can administer vaccine. And we encourage pediatricians to come and help us out at our clinics as well. So the partnerships are many and varied and have been a key structure in getting the vaccine out and how we are managing the pandemic through community-based efforts. So I'm very happy that we continue to work with so many different entities on getting this out. Partnerships are greatly appreciated, and we hope to see you down at the Capitol Center today.
Thank you, Dr. Whalen, and the great partnerships. In talking about partnerships, we have a great one with the Alliance for Better Health, and Juliet to my right here, and to your left if you're watching this, and if you're listening, doesn't matter, right? But I've talked about partnerships, and I talked about how you can be part of the solution, not part of the problem. And one of the biggest issues and the most anxiety, and probably added to a lot of people's PTSD, was trying to register for this vaccine. And I never understood why the state never did this, and the issues people were having navigating the website, and the frustration, the tears I've heard people talk about, and people talking to me about crying and how hard it was on them. And how younger kids had to step in that were tech savvy, and it was like, they had 5 computers going at the same time to get a slot, or someone would get a slot and they had to go to Utica, or they had to go to Potsdam, or they had to go to Plattsburgh, which made no sense when a 90-year-old's driving up to Plattsburgh to get a vaccine. I remember having this conversation with Steve McLaughlin, and we're like, we gotta fix this. We gotta make it easy. So I did the partnership with United Way. But really what has been successful is the pre-registration tool. And we pre-registered over 45,000 Albany County residents, over 45. And what's that mean? Of those, 40,000 were successfully vaccinated, but it also helped fill our pods. It helped with multiple pods around the county, around the Regent, around our capital district, and it was a huge success. Yes, we hit some, like anything else when you launch something, you're going to trip over stuff, but you learn from it, and you pick yourself up, you dust yourself off, and you continue to move forward. And the system, again, was utilized around the capital region. And then I got Rensselaer County on board, Schenectady County on board, and it saved a lot of time from staff calling people, making sure the registration information was correct and everything else. And having one of the highest vaccine rates in the state tells me that this pre-registration really worked, and it was such a useful tool. And I can't thank Juliet enough and for all her work on this, staying with us, because it was a lot of hours, a lot of frustration, a lot of people saying it couldn't be done, and it was one thing I kept trying to say to the state: we did it. And was it perfect in the beginning? No, but we got it to where it was perfect and where it needed to be to, again, make people's life simplify the process, but take the anxiety away. But please, Julia, talk about it more and everything else. And I do want to say thank you so much for being a good partner. It's really been great working with you these last couple of months, and to your whole organization. Thank you.
Yeah, sure. Well, thank you, and thank you to Dr. Whalen as well for just being such great partners. And I think that is the basis of this. This is partnership at its best and at its finest. And when we first started this, we were all wearing parkas, which today is a great day for an ice cream cone, but it's also a reminder of just how long we've been at this, and not to relive the past, but as you laid out, County Executive, when this first started, there was such demand for the vaccine, and there was not a lot available, and that really led to a scarcity mindset within our populations, and people were really frustrated. And I think one of the most frustrating parts to people were if they couldn't book immediately a vaccine that day, they kind of had nothing else to do. It was just this idea of you're going to have to come back, you're going to have to come back. And we really flipped the script on that. And the Alliance for Better Health is an organization here in the Capital Region, and really stepped up to your call for partnership and said, let's try something new here. And we did. We built a pre-registration system, which was available online to anybody who wanted it. And it really helped not just the public and folks looking for a vaccine, but it really helped providers as well. And I think that's where you were going with that, is that there was such complexity to the eligibility, but there was also complexity on the provider side. Vaccines were earmarked for very specific populations. People had to reach specific populations in sometimes just a matter of days. So you were given vaccine, you were given 48 hours to find, all the transit workers in the Capital Region, and the question was, how do you do that? And that's really what led us to build this system. As you said, we got a whole lot of use out of this, and I agree with you. I think that's what's helped push the rate here in the Capital Region, and that makes us obviously very proud. There were 4 key components, just sort of looking back, I think it's fun to share. The pre-registration form, as you said, over 45,000 county residents successfully used it. Managing the data was a challenge, and we were very cognizant of making sure that people who were sharing their information with us, it was held securely, it was not available to the public, they were able to know that it was going to the right people. And so we also built a back-end connection with NICES, and this became really important to us as well. We didn't want to outreach and offer vaccine appointments to people who had already been vaccinated, and the faster we rolled out vaccinations, the more critical it was to keep that list fresh and to know every 48 hours we were taking 1,000 people off the list, which really moved up the next 1,000. So that was a really great partnership with our local Rio. Of the 45,000, we just crunched some numbers the other day. Over 42,000 of those have successfully been vaccinated. Nice. We know that there's still people on the list. We are still in communication with them. They might be holdouts, although the free ice cream may, push them over the edge, hopefully. And then the third piece was really the outreach to residents, as you said. It was a chaotic time. It was hard to know where to go for information, and we really flipped the script and said, let us come to you. And so we were sending emails, if that was the contact information you provided. But really what struck us and what I'd love to share is it was really the text messaging. That's really what seemed to work for people, getting a text message a couple times a day that said, hey, there's a pod, you're eligible now, click this link, make an appointment, be there. For those of you who might have used the system, you might know we got more and more creative as time went by. We figured out that emojis really work. They help people click that link. I think just adding a little moment of levity to the situation might have helped. We sent over 93,000 text messages. These are not texts that are sent by hand, that this is a whole system. So it's an interesting infrastructure that we put together, and we're very happy to have done it for for our county. The other thing that I think we may have mentioned earlier on, but we really built this with a lens of equity. And so every time there was a pod, every time there was a pop-up clinic, we used the CDC's Social Vulnerability Index, and we messaged people in socially vulnerable zip codes first. And so this was really a way to say, we know these populations need a little extra time, a little extra help, and we always gave them sort of first crack at making those appointments. That seemed to really work for us as well. The closer people live to a pod, the more likely they are to show up. That feels kind of obvious, but that's the other way we built clinics, is that we invited people from neighborhoods surrounding the clinic first, and then we would fill it from people who are a little further away. And then the last piece, but I think this is an important piece for us as a community moving forward, organizing community pop-up clinics before it was cool. The first pop-up clinic we did was in early February. This was sort of before everybody else kind of came to this realization. We recruited a number of non-traditional vaccination partners, EMS agencies, Mohawk Ambulance, which was a great partner this whole time, pharmacies, individual pharmacists. At this point, we've done nearly 50 pop-up clinics, and that represents 9,500 vaccinations. These were pop-up clinics that started right here at Albany Housing Authority, but then we spread out all across the country. We did rural, we did urban, we did public libraries, we did the Watervliet Senior Center, which I see has reopened. So it was a tremendous amount of work. It was done obviously in partnership with you and so many others, and I think we learned a lot along the way. And the thing that I would also say is that we built this infrastructure, and while the situation has changed, and now it's a game of sort of finding folks who are still looking for a vaccine, doing a lot of education, doing a lot of engagement, this infrastructure that we built in service to our residents, it's not going away, it's built. And knock on wood, we'll never have to dust it off, but it is now there, and it is now built, and so the next time we need something like this, it'll already be there. So I would just love to say thank you to yourself, thank you to Dr. Whalen. It's not easy to allow a third-party group to innovate and kind of come in and try things very quickly, learn what works, iterate. So thank you for allowing us to do that. I'd also say all the providers that really stepped up and made their services available. We worked closely with Mohawk Ambulance, FEMA, the College of Pharmacy, Marist Pharmacy, Lincoln Pharmacy, many EMS agencies. It's been tremendous, so thank you.
Juliet, thank you, and I'm glad you brought up about the pop-up clinics and everything else, because again, without working together, it doesn't happen. And I actually forgot, I think I kind of like blocked a lot of it out when under the restrictions we were under. Like they would say, oh yeah, here's 500 vaccines, but you can only do this type of age group, or the restrictions put on us were basically almost, I felt like we were being set up for failure. That's what they wanted, and this really helped us identify, deep dive into the groups to make it happen. So I do want to say thank you. And also, I know that the Alliance just launched education, going into the community, going to talk to people, because again, there's still people on the fence, so to speak, and we're going out there and we're doing everything we can to get you educated, to have you understand why it's important to get vaccinated and get them people out. So thank you for that. The other initiative that the Alliance just put out, because like you said, and all the partners that we I could go on forever. The great partners we've had out there that have worked with us, have reached out to us, continue to do things. So thank you, Juliet, and we really do appreciate you and your team and Alliance for Better Health. We couldn't have gotten through it together or without working together, and that's why I keep telling people, partnerships, people, it makes things happen. And don't be afraid not to be the smartest person in the room, because people can come up with extraordinary ideas that can advance, and it's about protecting the health and welfare of our residents and going into that population of people that weren't getting vaccinated. We did everything in our arsenal, and I can tell you the discussions Dr. Whalen and I had, that was a top priority, and it still is a top priority of our administration to get into this. But we have to sleep at night, and I can assure you we have tried everything we can to get people out. But I do have to clarify the Stewart's ice cream, because my deputy Dan Lynch just texted me he can't get one then. He can't get a free ice cream cone? All right. Sorry, Dan. Doctor said no. But again, working together to get it done. And just talking about getting it done with the federal government, there's so much money that's been put out there from the American Relief Act for a variety of things. Please, people, go out there. Business owners, we need you to do it. I know, listen, I've had meetings yesterday with people from different states and different county executives about the issue of getting people back to work, and we're opening up, so we need workers to get back into the restaurants and to the hotels and to that industry so we can get moving forward. But one of the things we did learn was about internet, and it's been something that's been on the radar for 10 years. Unfortunately, it takes something like this to really move the needle to get stuff done. A lot of great initiatives we did in the hill towns to bring internet to kids that Burn Knox, Westerlo, that did not have it. Setting partnerships with the Sheriff's Department, Sheriff Apple, and everyone else that was involved, and my team for getting it done. Thank you. But get emergencybroadband.org. You can go there and check it to see if you are eligible, and they will cut 50% off your bill if you are eligible. So please, by all means, go there and see if $50 off the internet bill each month. They will take $50 off your internet bill if you qualify. Please go and see if you qualify. It's worth $50 a month. 2 months is $100, and so forth. So please check that out. If you want to get vaccinated, as always, and you got questions, call the state 1-833-697-4829. I mentioned earlier about Crossgates and wherever else you can go. Go to our website, albanycounty.com. Use the red bar across the top, which will take you to our COVID page, and you can see everything to get testing. We still need, I think Dr. Whalen said this the other day, our testing's going down. People just aren't going to get, if they don't feel good, we encourage you, please go get the COVID test. Make sure you don't have it, and, and do your part. And mental health support hotlines available 7 days a week from 8 a.m. to 5 p.m. as always. And our 24-hour sexual assault hotline number is always available, 518-447-7716. Getting a lot of, we still get a lot of questions on a variety of things. And I know we're opening up, I think May 17th, the museums open back up and everything at the state. Please, Governor Cuomo and them, take the barriers down on State Street. It's long overdue. And I remember when Governor Pataki did that and the governor came in and took them down. It's time for them to go away. We got to open up. People have to have the sense of government's open. And, I don't know why they're still up, but we keep getting that question. So I will bring it up and find out why that road's still closed. Again, I know we're still getting the questions from the landlords on their assistance, and I think well over $400 million. I think the website from ODODA is coming out next week, supposedly. I wish Craig Floyd did a counter from Channel 6 on this, and hopefully it gets done. They figured out how to take our money. They just didn't figure out how to get the money out, which I'm not surprised. That was their first priority. So thanks, Mike Heim. But hopefully I'll be waiting anxiously to see this website come out on the 23rd, because, again, it's about working for people, getting things done in a partnership and helping each other out. Please stay safe out there. Wear your mask, cough into your arm. Clean your hands 6 feet apart. We're almost through this. Hopefully you won't have to see Dr. Whalen or Juliet or myself for a long time. We're almost there. And trust me, we're all tired and we're all looking to relax and take a long vacation.